Development in the COVID-19 cases in India. The total number of cases in the country has now crossed the 1,000 mark. This is the latest that is coming in, with the number of people who have died reaching 27 now. Sneha Murdani is joining us with more details. Sneha, the 1,000 figure now crossed in India. Are there any specific regions where we've seen any significant jump?
Yes, in fact, there are hotspots in India that continue to have a large number of cases. For example, Kerala, which has 182 cases, and Maharashtra, which has 186. In fact, right now, we're also talking about Karnataka and Telangana. Karnataka has 76 cases. Gujarat again. Until just about 10 days ago, Gujarat didn't have cases. Gujarat is now having 5 deaths and quite a few number of cases. It stands at 58. Apart from that, Rajasthan has also reported in fact, quite a few cases. This is 55. Telangana again continues to be a hotspot. UP stands at 65. However, Maharashtra and Kerala are the states which have the maximum number of cases. However, Maharashtra's death also is at 6. Kerala has 1 death, which it has been reporting on. I do see some amount of discrepancy in the data. Maha, there seems to be a little bit of mistake in the chart that has been put out by the government, and I'm just reading from the chart. Rajasthan has actually reported deaths in the past, but right now it says deaths 0. But there have been deaths from Rajasthan as well. I think there's a mistake. We'll try and get a clarification on that. But also to point it out quickly to you, the number of people who have in fact recovered, cured is not the word, recovered stands at 95, of which 97, in fact, 1 is a migrated case. That person, in fact, that patient is in Singapore. So it stands at 95 in most of these patients not using the anti-HIV drug that has been prescribed to a handful of them. Of course, they have to fit into the protocol for using the same. The government has already spoken about the fact that it is not effective in severe cases. What they really require is supportive treatment, and that is being given. However, the number of recoveries also is quite high at 95, like I mentioned. Death again has gone up. Death stand at 27, and that also is a figure that is worrying, given the fact that now we're also reporting of people dying who are below the age of 60, in their 40s. But however, the ICMR and the government continues to maintain that these are the people with comorbidities. They have hypertension, diabetes, and other illnesses, which brings the immune system down in any case, and that is the reason. The other problem, quickly, I just want to point out, is that a lot of people continue to hop from one private hospital to the other. This has been a huge concern, and government says that this has to stop. In the case of the Gulbarg patient who passed away, the 76-year-old man, he actually, in fact, inadvertently, before losing the battle to COVID-19, infected 3 of his family members. The family also got a call from the DC for the patient to report to a particular hospital, but he did not. Instead, the family hopped from one private hospital to the other. They actually went to 3 private hospitals. So that continues to be a bit of concern. Also, people not coming out in the open, in fact, misleading on their travel history and also on their contacts. That continues to be a huge concern as well. The geographical spread in the last 2 days continues to be confined to 27 states and union territories, and that, in fact, has been static for the last 2 days now.
Sneha, considering that the graph is continuing to go up, is the government looking at now starting aggressive testing, and is that possible?
Yes. The government has already said that they are testing aggressively. In fact, we did play out the interview of the Indian Council of Medical Research, the head of the epidemiology department, Dr. Raman Gangakhetkar, who says that, in spite of the fact that we widen the criteria, not many people are coming. In fact, we're not even turning people away, is what he claims. Private labs, 47 of them, they do about 400 tests daily. And government labs and private labs together, government labs 118 in number, they're just doing 2,000 tests a day. Government labs, if they were to test on their own, 118 are capable of doing 75,000 tests on a weekly basis, but they're not doing it. Apart from that, 5 lakh kits have been ordered. These are antibodies serological kits, which basically take the sample from the blood, and that's how a diagnosis is made. That test takes about 20 to 45 minutes. The test that we're doing right now takes about 6 hours. In fact, there are 2 tests that are done to confirm. That's time taking. And the second test that I mentioned also is something that is going to be used for surveillance. Obviously, to continue to rule out community transmission, the surveillance test is going to be done using the serological method.
Sneha, how soon can India look at getting these kits which you are mentioning, which test for antibodies, and this could be a faster way of testing people and figuring out, and a quicker way of then isolating them and getting their contact tracing done, right?
Yes, absolutely right. In fact, the serological test, what it does is that it detects antibodies in the blood cells, and that is what helps understand if a patient has been carrying the infection. It's going to be used for surveillance. You know, I'm just wondering, if you're using it for surveillance, is it going to be used on people who have pneumonia or who have influenza-like illness? Is it then going to be used on these people who are already, in fact, being tested in dispensaries and doctors that they go to? I think yes. To answer your question on how many days, well, 26 was when the bidding actually closed, and the requirement of the government is very specific. We need 5. Earlier, they had put forth the request for 10 lakh kits, and they had not given a time frame, saying do it as soon as you can. However, they've revised that, saying that do what is possible. 5 lakh is possible, but do that in 5 days' time. So I think in another 2 or 3 days, we should be getting 5 lakh kits, and these are going to be sent to 6 different locations in the country. There's a list also of these locations, and that's how this testing is going to start. Also, Maha, quickly I want to point out, the government continues to maintain that there is no community transmission in India. However, these tests are being done, like I mentioned, of people with influenza-like illness. In medical parlance, it's called ILK. People also have pneumonia and other respiratory distress. These are called SARI cases, which is severe acute respiratory illness cases. Some of them, a handful of them, have been diagnosed with COVID-19. The government says we would want to believe that these are not cases of community transmission. These are cases of people simply concealing their travel history, also not sure about coming in contact with COVID-19 patients, because the number of these people is insignificant. And these cases are being reported from cities and from states that are already infected. So no reason for us to be 100% sure about the fact that these are isolated cases of community transmission. Also, for us, every reason to believe that these are cases perhaps of travel history which has been concealed from authorities. It has happened in the past. There's every reason that people are still doing it, given the kind of fear and stigma attached to the infection.
Sneha, also, please put into perspective once again, the current testing that is being done takes about 6 hours for the results to come out. When India has these antibody testing kits, how soon can we get the test done? What is the time frame? And, America has announced that they have Abbott has come out with testing kits which will give results in 15 minutes. Is it anywhere close to that?
Yes, but India has not been approached by Abbott, is what the government has said today. We did put this question in the press conference. In fact, the government said that Abbott is not marketing the 5-minute test here right now.
5 minutes,
again, they continue to maintain that this again, the one that Abbott has spoken about, the 5-minute test, is again an antibody test. And we are looking at starting the antibody test, the serological test that I just mentioned to you, Maha. So I'm not too sure if the government is going to then go ahead with getting in touch with Abbott or not, but they claim that Abbott has not approached them just yet. Also, the other thing about your question on how long will this take, anywhere between 20 to 45 minutes. Right now, the time taken is 6 hours. The first test, the primary test, as we know, a swab is taken from your nose and your throat, and then if confirmed, the second test is done again, and that is confirmed. It's called the confirmation test, and the process takes up to 6 hours. This is going to be quicker, but again, like I said, this is not for detection, but it is for surveillance. I think, obviously, the agenda right now, and everybody seems to be working in this direction, I think it's very clear. One, to avoid community transmission and mitigate it if at all it has set in. The government says we believe it has not. We want to believe that it has not, and we don't have evidence of the same. And the second thing is to have this individual sort of an approach to problem states like Maharashtra and Kerala. The government calls them hotspots. These are hotspots in the sense of the number of cases that have increased
Yes.
in many of these places. Maharashtra, Kerala, Telangana, I named a few that the government is looking at. Not cities, but states.
Okay. Okay, Sneha, stay on with us. Dr. Sanjeev Bagai is also joining us on the phone line. Dr. Bagai, first of all, we are seeing the graph going up. India has crossed the 1,000 figure now of the total number of coronavirus cases. Now, under such circumstances, sir, is aggressive testing the only way out now to be able to isolate and quarantine people accordingly?
Yeah. So to answer your question in a little bit of depth so that the viewers can understand.
Sure.
More we test, more positives we will get. That's a worldwide phenomena. There is no ambiguity in that. Now, just getting a positive is not to say that he's positive and he's going to die.
Naturally, yes.
A vast majority of these patients are asymptomatic, although they may be carriers.
Yes.
So the next point number 2 is contact tracing. So one is testing, identify, and then the contact tracing. That is the most tedious and the most difficult job, but I think the government is doing it very meticulously. Point number 3 is home quarantine, which is lockdown. So the first two have to be in conjunction with point number 3, which is lockdown. So that means public health efforts have to continue unabated along with the country's comprehensive lockdown. And point number 4 is we are not looking at a top line, which is how many number of 1,000 patients which are positive. We want that low, yes. But the most important thing is we have to keep the mortality figure as low as possible, as minimal as possible.
Certainly, yes.
So if you are looking at a given number of deaths, that also can be correlated to not too many very, very sick, bad, coughing, breathless patients are visiting the offices of the doctors or in the hospitals. So if it was that rampantly community spread already by now, the bottom line in terms of fatality would have been a lot more. But having said that, my end statement is we cannot put we have to be vigilant, and the storm is yet to come. So the patients which have been building up as asymptomatic carriers and quietly spreading it are being tested and are being picked up now. So our comprehensive surveillance and all what the government is doing, we have to be hand in hand with them and help them. The next, I would say, 10 days would actually depict what the total toll will be. If it goes, in the end, one last statement if I have the time.
Yes, please go ahead.
In the end, my concern is if it goes into the community, as actually it has happened in Italy or in Spain, they're completely devastated. Italy has a mortality rate of 11%. That is unheard of in this kind of illness.
Yes.
Primarily because they didn't take the preventive measures of lockdown early.
Yes.
My concern in India is because geographically and medically it's a very different country. We have a high rate of protein energy malnutrition, tuberculosis in rural India, other bacterial pneumonias, and so on and so forth. So what will happen is in that low immunity group, which is a very, very large number, this infection may actually catch more speed than otherwise.
Okay.
So to come back to the first point is we need to nail it now. The only thing which we can do as citizens is stay at home and enjoy ourselves while all the others are working. As we as doctors are still seeing patients in the outpatient, we are still exposing ourselves. So the doctors do their work, the government is doing the job, the civil society per se, just stay put for another 18-20 days and we hopefully will be through this crisis.
Dr. Bagai, we hopefully will be able to actually overcome COVID-19 in India. But the next question that one would want to know about is that since 95 people have recovered, are we seeing that line of treatment which India is using as some sort of success, and is that something that is going to be replicated really?
See, all the treatment, this is an important question, all the treatment which is being used worldwide at the present moment is with what information we have as scientific data at the present moment. Keeping in mind that this novel virus is only 3.5-4 months new into the human body and system.
Yes.
So as we speak on a daily basis, we are getting more and more scientific papers and literature which is coming across from all parts of the globe.
Correct.
And WHO is trying to collaborate it and give some sort of reasonable medical therapy. But the message to a viewer should not be that the person self-medicates at home.
Okay.
Because it can be extremely dangerous.
Okay.
So there are
All right.
certain drugs which are being tried under the present situation with the limited scientific papers which we have published as yet.
All right. Dr. Bagai, Sneha wants to take one question. Sneha, go ahead.
Yes, Dr. Bagai, good evening. I just want to ask
Good
you
evening.
that I've been repeatedly asking this question to the ICMR because 400 private labs are testing, 118 labs, government labs are testing. Dr. Raman Gangakhetkar says that we are not turning anybody away. So why are we only testing 2,000 samples a day? In your understanding, why is this happening? If people are not being turned away, then why is the number so low? I mean, this is a country of 1.3 billion people. And if the capacity is more than 75,000 per a week for 118 government labs, then why is the per day figure so low?
Yeah, that's a fair point. But let me flip the coin and answer this question backwards and then coming forwards. There is no country in this globe which can randomly or across the society and screen and test actually with a real-time PCR the entire population. So what the ICMR and the Indian government has done is correct, that they have laid down guidelines as to who are the high-index people, high-risk people, of high-risk travel, coming in contact, symptomatic pneumonias, inpatients who are reaching with cold cough fevers. That's a fair criteria. So what the government is doing now is testing on who is required. Please understand, in a country like India, 40 to 50% of an outpatient clinic, that's an OPD clinic load, be it in children or in adults, is respiratory. Every respiratory infection and fever is not viral to begin with. It can be bacterial too. And every virus is not a coronavirus. Coronavirus symptomatology, that means who are the symptomatic group. You need a very, very typical hacking dry cough. You need something which is of a high-grade fever. Almost 85 to 90% of the people have this as a cluster of symptoms. And last is you have dyspnea, which is breathlessness with low oxygenation. So these are the kind of symptoms which generally a corona patient has, or if a person comes in contact with. So the testing is being done on what is required to be tested rather than testing an entire community, which will just add on the numbers but not give us so much inference.
All right, and also be misleading in the sense because asymptomatic individuals also, develop the symptoms maybe on the 4th day or the 5th day of the infection, and that's why the strategy of the government has been that the testing protocol is not that wide in that sense. Now, of course, they've gone ahead and widened it.
Right. Sneha, we'll have to leave it at that. Dr. Bagai, many thanks for joining us. Sneha, also thanks for joining us. We have some more news.